Good afternoon, ladies and gentlemen, and thank you for having me. Stephen Covey once remarked that when you show deep empathy for others, that's when you can get more creative in problem solving. And nursing is all about empathy, understanding other people, and solving problems in their lives. Today we'll be looking at the 5 pillars of communication in the nursing profession. These 5 pillars are empathy, collaboration, accurate representation of facts, cultural sensitivity, and active and effective listening. But these communication principles apply not only to nursing, but also to our everyday lives, careers, and families. These 3 pillars can be organized into 3 specific categories: care, conscience, and consciousness. Under care, we can look at cultural sensitivity and empathy. Empathy is defined by Webster's Dictionary as the action of understanding, being aware of, and being sensitive to the feelings, thoughts, and experiences of others. In nursing, this is vital because if we can understand what's going on in people's heads, their mental state, and how they're feeling emotionally, then we know how to get through to them or what we may need to overcome so that we can communicate with them effectively. This is true on a broader scale as well. If we can understand what's going on in the people around us, if we're aware and have compassion for what they're going through, then we can communicate with them well because we're not coming from where we're coming from, but we're understanding where they're coming from as well. But we also have to understand culturally what's going on with the people around us. Cultural sensitivity is the recognition that there are differences between cultures. In nursing, we get people from every walk of life, every culture, ethnic background, personal background, lifestyle choice, etc. And as nurses, it is our job to understand that this is part of people's identity and that we can work with them and through those identities, not in spite of them. This is true communicating on an everyday basis as well. If we can understand people's identities and where they're coming from, their backgrounds and beliefs, then we can use this as a tool for enhanced communication and effective communication, not something that we have to overcome when we're conversing with people. But we also have to look at conscience, the second category of nursing communication. And under this, we look at collaboration and accurate representation of facts. Collaboration is using the resources and specialties of the people around you to provide a better result. In nursing, we use collaboration all the time. Nursing isn't a standalone profession. We're also working with doctors, other nurses, dietitians, nutritionists, physical therapists, etc. And we're using the skills and talents and specialties of those around us to provide the best result for our patient. We can't do it alone. We have to do this on an everyday basis as well. We have to use all of our resources, if it's coworkers, families, friends, or even just all of the resources available to us personally. And it helps take the stress off because we're using all of our resources to the best of their ability, to their maximum capacity, and it creates a better product. Accurate representation of facts is also important. This is also called veracity, telling the truth so that people understand and can make informed decisions. In nursing, you have to be very careful that you provide accurate facts because you're providing information about people's medical status, their medicines, their blood pressure, how much they've eaten, or how much they've moved. If you can do this, then you can help protect them and care for them instead of putting them in danger. This also helps build a rapport and trust with those around you, and this is true on an everyday basis as well. Telling the truth helps others trust us and gives us credibility so that they can make better choices and we can help them more and communicate more effectively. The last category of nursing communication is consciousness, and this manifests in active listening. Active listening acts to check understanding so that the speaker knows that the listener has really understood what's been said, according to Boyd and Dare in 2014. Active listening allows us to be aware of the situation, and in nursing it allows us to ask questions back to our patient to ensure that we understand what's going on with them and that there's clarity in between us and in our communication. This is true on a general scale as well. It keeps us engaged with our surroundings and with others and what they're saying so that we learn more and so that we know how to communicate effectively with them because we understand what they have said and what they're thinking and feeling. And this gives us the tools to be able to understand how we need to communicate with them. I like to think of nursing communication like a stethoscope. Care is the bell where we're listening to people's hearts, minds, and emotions so that we understand where they're coming from. We're aware of their backgrounds and their cultures as well. The tubing is collaboration and accurate representation of facts, where we're connecting with other people and we're coming together, bringing parts together so that we're using our tools to the best of our ability. And consciousness or active listening is the earpiece, where we're using our awareness to make sure that we understand what's going on in a given situation. Together, these provide the 5 pillars of nursing communication. Today, we've looked at the 5 pillars of nursing communication. We've looked at care and how empathy and cultural sensitivity can help us care for those around us and give us perspective and compassion. We've looked at conscience, where we're allowing others to help us and giving accurate facts to build rapport and yield better results and better care. And we're also using our consciousness and our awareness. We're learning how to choosing to listen well helps both us and our clients, families, or friends. In the words of James Hume, the art of communication is the language of leadership. And while I think nurses are leaders in the medical community, we are all leaders in our own right in our own professions. And no matter what your profession is, your status, your goals in life, where you are now, communication and good communication will take you far in this world. Using tools such as the ones that we've discussed today will be a powerful advantage as you make your way into the future. Thank you.